Alright, so today we're going to be treating Brad's subacromial bursitis, and his doctor has asked us to treat with ultrasound. So Brad, have you ever had ultrasound done before?
Yes.
You have? Okay, so today we're going to try to deep heat some of those tissues in your shoulder, and the way we do this is with the sound waves that come out of the sound head, and they basically cause a vibration that creates energy, which creates heat. And so basically it will go through all the superficial tissues to that deep area that we want, which will help to decrease some of your pain, inflammation, and hopefully flush some of that fluid out of that area to make room for new fluid, which will actually help to heal the area a little faster.
Okay.
So I'm just going to clear a couple of contraindications with you before we begin the treatment.
Okay.
Do you have a pacemaker?
I do not.
How about any cardiac issues that I should know about?
Nope.
Have you ever had any surgeries or metal implants in the area?
No.
Have you ever had PVD or DVT?
No.
How about diabetes?
No.
Okay. Any cancer?
No.
Fractures in the area?
No.
Okay. And this is a chronic injury, so there's no shard. I'm just going to quickly check. So I don't see any shard. I don't feel any heat. So we can rule out that it's an acute injury. And I don't see any skin lesions or anything like that. Do you know if you have any impaired sensation in the area? So you're good with touch and hot and cold?
Yeah.
Okay, good. So today we're just going to heat the area. So you might feel a little bit of heat at the surface.
Okay.
If it gets too hot, you let me know.
Okay.
But you really shouldn't feel much. I'm going to test your hot and cold sensation. So 2 test tubes, and this one's hot, this one's cold.
Okay.
I want you to turn away, and I want you to tell me what you feel.
Hot. Cold. Hot. Cold.
Good. So to begin, I've washed my hands. The area is clean and safe. I'm going to wash the patient's area that we're going to be working on with alcohol swab. And before we begin, do I have your permission to use ultrasound on you?
Yep.
Okay. So we're going to drape the patient so that his clothing doesn't get any lubrication on it. We're going to set the settings for ultrasound on the machine. We're going to edit the settings. We're going to use a frequency of 3 megahertz. This is to use superficial, 100% duty cycle because we want some heating to occur. We're going to put the watts per centimeter squared at 1 to actually increase that heat. And we're going to treat for 7 minutes to reach a therapeutic effect or therapeutic level and to treat at that level. So I'm going to apply gel to the sound head, and we are going to start the machine, and basically we are going to be circling around the area no bigger than 3 times the sound head, and you let me know if at any point in time you want to stop the treatment or if it gets too hot.